it's Dr. John Hamel from Complete Laser Clinic, and we're going to talk liposuction today. What I have in my hand is called the Hamel Lipomatic or Tickle Lipo. This rotates at 10,000 times a second. It's infrasonic, and what it does, it has a vortex rotation. Let me show it to you. Okay. Why is this important? Because as it infiltrates, as you'll see, the vibration goes with the delta gate theory of decreased pain sensation. By vibrating, it takes away a lot of the pain sensation that the patient's having. Also, by vibrating, the sprinkler system with the multi-hole cannula allows tumescent fluid to be spread quickly and evenly throughout the tissue, so your tumescent time and patient tolerance is much decreased. Let's take a look at how it works. Vibration. Infiltration. So what I'm going to do is some super wet tumescence where we infiltrate her skin. And the adipose tissue at a rapid rate with tumescent fluid. Our tumescent fluid is your standard Klein solution, which is 1,000 milligrams of lidocaine, 10 milliequivalents of bicarb, and 1 milligram of epinephrine, and a liter of normal saline. Now look at the ease from going through the umbilicus. Look at the ease and how much infiltration I've done in less than a minute. Stop. Okay, as you can see, we've tumesced 2 liters in about 5 minutes. The patient's done very well. The reason this is called Tickle Lipo is because the vibration at 10,000 times a second causes people to laugh, especially when you're going over the side where there's ribs. I'm going to give you an example of how well this works. It's just your standard Mercedes cannula attached to the Hamel Lipomatic or Tickle Lipo, and we have suction on and on. So look how my hand's holding it. I'm barely working it at all. The actual handpiece is doing all the work. Even over those tough to get intercostal fibrous areas, the Tickle Lipo is just stripping the fat off in a nice, safe manner. See what's coming in the bucket? So I really do believe that Tickle Lipo is one of the best systems out there. I've done liposuction multiple ways, and I think this is the way I would do it the rest of my life until something better comes along, which I just don't see that happening for a long time. And the reasons I say that, again, is the way the patient can tolerate the infiltration and the liposuction, the ease of using the handpiece, the speed of using the handpiece, and the decreased chances of cannula grooves or unevenness. And because it rotates, you need a lot less holes. With just one umbilical hole, I can do her whole abdomen. The way I compare it when I talk to physicians I'm training is Tickle Lipo is like cutting a tree with a chainsaw versus cutting a tree with an axe. When you use your manual tools, it's like cutting a tree with an axe. When you put Tickle Lipo in your hands, it's like you put a chainsaw in your hand and you do excellent carving, excellent work. Thank you very much. Hope to see you guys soon. So now we have our patient standing. We're going to do some orthostatic liposuction, and Tickle Lipo is the best instrument out there for orthostatic liposuction because it does all the work for you and quickly. On, please. off please. Again, you notice how smooth the contouring is. There's no cannula grooves. There's only one incision. This has been done in about 45 minutes. We've taken out over 800. So this is just an incredible system. I think it's the best thing out there. Look forward to seeing you guys soon. Thank you very much.